The American Diabetes Association, or ADA, often recommends a more relaxed Hba1c target such as 7.5% to 8.0% or even higher for older adults. That is mainly because American Diabetes Association think they have limited life expectancy, comorbidities, and cognitive impairment. Rather than trying to extend their life by limiting the chance of side effects of poor blood sugar control, they mostly recommend hypoglycemia causing medications like insulin treatment. Tight blood sugar control increases the risk of hypoglycemia, which can be particularly dangerous for older adults, potentially leading to falls, confusion, and other serious health issues. The benefits of strict glycemic control, such as preventing long-term complications. ADA consider that as not important for older adults with a shorter life expectancy compared to younger individuals. Managing diabetes with very tight glucose control can be burdensome, involving frequent blood sugar checks and insulin adjustments. A slightly higher Hba1c target can reduce this burden and improve the overall quality of life. Coexisting conditions: older adults may often have multiple health conditions that need to be managed simultaneously. Balancing the treatment of diabetes with these other conditions can be challenging, and a less aggressive Hba1c target may be more practical. Functional status and cognitive function: older adults may have decreased functional status or cognitive impairments, making the strict management of diabetes more difficult and potentially unsafe. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. Thus YouTube will serve more videos to suit your interest on similar topics. First off, what's Hba1c? It's a blood test that shows your average blood sugar levels over the past few months. For most adults, doctors aim to keep it under 7%. But for older folks, especially those over 70, the rules are a bit different. Now, you might be wondering, why would doctors be okay with higher blood sugar in older people? Well, it's not that they don't care about older folks' health. It's actually the opposite. They're looking at the bigger picture. As we get older, our bodies change. We might have more health issues to deal with, and keeping blood sugar super low can sometimes do more harm than good. Doctors have realized that a one-size-fits-all approach doesn't work for diabetes care, especially for older adults. Let's break it down a bit. When you're younger, having tight control over your blood sugar can help prevent long-term complications of diabetes. But when you're older, the risks of trying to keep your blood sugar too low can outweigh the benefits. One of the biggest concerns is hypoglycemia, or low blood sugar. It's a serious issue for older adults. Low blood sugar can cause dizziness, confusion, and falls. For an older person, a fall could lead to a broken hip or other serious injuries. So, doctors try to balance the risks of high blood sugar with the risks of low blood sugar. But it's not just about avoiding low blood sugar. As we age, we often have other health conditions to manage. Diabetes is just one piece of the puzzle. Doctors look at the whole person, not just their blood sugar numbers. For example, if someone has memory problems or needs help with daily tasks, it might be harder for them to manage a complicated diabetes treatment plan. In this case, a simpler plan with a slightly higher blood sugar target might be safer and easier to follow. Now, don't get me wrong. This doesn't mean that if you're over 70, your doctor will ignore your blood sugar. Far from it. They'll still work with you to keep your diabetes under control. But they might set a higher target for your Hba1c. So, what kind of targets are we talking about? Well, it depends on the person. For a healthy, active 70-year-old, the target might be similar to younger adults, around 7% to 7.5%. But for someone who's frailer or has other health issues, the target might be 8% or even 8.5%. The American Diabetes Association has some guidelines about this. They suggest that for older adults who are otherwise healthy, an Hba1c of less than 7.5% might be appropriate. But for those with multiple chronic illnesses or cognitive impairment, a target of less than 8.0% could be okay. And for those with very complex health issues or limited life expectancy, they say it's fine to aim for less than 8.5%. But remember, these are just guidelines. Your doctor will work with you to figure out what's best for you personally. It's not just about the numbers, it's about how you feel and how well you can manage your diabetes care. Now, you might be thinking, but won't higher blood sugar cause problems? It's a good question. High blood sugar can indeed cause issues over time. But doctors have found that for older adults, the immediate risks of very low blood sugar often outweigh the long-term risks of slightly higher blood sugar. Plus, when doctors talk about allowing higher Hba1c in older adults, they're not talking about letting it go sky high. They're talking about a moderate increase that balances the risks and benefits for each person. Let's talk a bit about why keeping blood sugar too low can be risky for older adults. As we age, our bodies don't always give us clear signals when our blood sugar is dropping. This means an older person might not realize their blood sugar is low until it's dangerously low. Low blood sugar can cause confusion, dizziness, and weakness. For a younger person, these might just be uncomfortable. But for an older person, they could lead to a fall or other accident. And recovery from these accidents can be much harder and slower for older adults. There's also the issue of multiple medications. Many older adults take several different medicines for various health conditions. Some of these can affect blood sugar or interact with diabetes medications. This makes it even trickier to keep blood sugar in a tight range without risking lows. But it's not all about avoiding risks. It's also about quality of life. Constantly worrying about blood sugar and dealing with the effects of low blood sugar can be stressful and tiring. By allowing a slightly higher target, doctors can help older adults have more energy and feel better day to day. Now, you might be wondering how doctors decide what's right for each person. Well, they look at a lot of factors. They consider things like how long the person has had diabetes, what other health conditions they have, how well they can take care of themselves, and what their preferences are. They also think about life expectancy. If someone is expected to live for many more years, keeping tighter control of blood sugar might make sense to prevent long-term complications. But if life expectancy is shorter, the focus might be more on preventing symptoms and maintaining quality of life in the near term. It's also worth noting that this approach of allowing higher Hba1c in older adults isn't just coming from individual doctors. Major medical organizations support this idea. The American Diabetes Association, the American Geriatrics Society, and the International Diabetes Federation have all adjusted their guidelines to recommend higher Hba1c targets for older adults. But here's an important point: this doesn't mean that all older adults will automatically have a higher Hba1c target. Some older adults are very healthy and active, and they might do just fine with tighter blood sugar control. The key is that doctors now have the flexibility to personalize diabetes care for each individual. So, what does all this mean if you're an older adult with diabetes, or if you're caring for one? First, it means you should have a good conversation with your doctor about your diabetes management. Talk about your overall health, your ability to manage your diabetes care, and what's important to you in terms of your quality of life. Don't be afraid to ask questions. You might want to ask things like, what should my Hba1c target be? What are the risks and benefits of my current treatment plan? Or, how can we make my diabetes management easier to handle? Remember, the goal is to find a balance that keeps you healthy and safe, but also allows you to enjoy your life without constantly worrying about your blood sugar. Your doctor is there to help you find that balance. It's also important to know that even with a higher Hba1c target, you'll still need to monitor your blood sugar and take care of your health. You'll still need to eat well, stay active as much as you're able, and take your medications as prescribed. The bottom line is this: diabetes care for older adults is not about letting things slide. It's about smart, personalized care that takes into account all aspects of a person's health and life. It's about finding the sweet spot where blood sugar is controlled well enough to prevent problems, but not so tightly that it causes other issues. So, if you're over 70 and your doctor says it's okay to have a slightly higher Hba1c, don't worry. They're not giving up on your health. They're looking out for your overall well-being and quality of life. And that's something we can all feel good about.